Hello, my name is Joel Cook. I'm one of the nursing lecturers at North Metropolitan TAFE, and today I'll be demonstrating intramuscular injection. Hi Mr. Kickett, how are you going? Let me get that call bell for you. Alright, why did you buzz? Okay, feeling a bit nauseous. Alright, let me just check your chart. Okay. Can you tell me your full name and date of birth, please? Fantastic. And I'll check your URN. Okay, great. Let me have a quick chat with the RN and see what we can get for you, okay? Hi Lisa, how you going?
Hi Joel.
Robert Kickett in bed 34 is feeling a bit nauseous. So he's been written up for metoclopramide that we can give intramuscularly. Are you happy if we get that for him?
Yeah, that sounds good.
Okay, great. Mr. Kickett, we decided to get you some intramuscular injection of metoclopramide. So that's an injection into the muscle. It's going to work fast and you have no risk of vomiting it back up. Is that okay if we get that for you? Great, I'll go prepare that now. So we've arrived to the clean utility where we'll prepare our medication for administration. So I've gathered all of my equipment, which includes a kidney dish to carry things, my medication, metoclopramide, a 3 ml syringe, a blunt drawing up needle, a 23 gauge injecting needle, which is what we use for intramuscular injections. We have our alcohol swab, which we're going to use later for cleaning the skin, and of course our gloves. And of course just a little receptacle to throw things away in. And our documentation. So Lisa, can we please check this metoclopramide?
Yes.
Thank you. So we have for Robert Kickett, metoclopramide, 10 milligrams and 2 mils, and expiry is February 25. So we're going to be giving 2 mils for Robert Kickett. We're going to be giving it intramuscularly, so we've got our needle there,
Sure.
and he's nausea and vomiting at the moment.
That's right.
And we're at documentation on the PRN side.
Yep, happy for you to prepare.
Great, thank you. So first thing is hand hygiene. Then don our gloves. And open up our syringe. Then when you're opening these up, make sure you're paying close attention to what the key sites are. So again, key site here, and then attaching them and putting them together, not overly tight because we want to remove it later. Then we can put that down and grab our medication. So you just twist the top off and throw that away. Grabbing our syringe again, pulling the cap off, and drawing up 2 mils. A little bit more than 2 mils for priming, just a tiny bit more. Now we can just twist this off, and put that into our sharps, and open up our injecting needle. Now again, be aware of your key sites using ANTT. Attach those two together. And these need to be attached tight, especially for intramuscular injections. Give it a bit of a flick if there's any bubbles at the bottom. And prime to 2 mils. Making sure there's a little bubble that forms at the end of the bevel of the needle. Okay, Lisa, can you just check that that's 2 mils, please?
Yep, 2 mils, I'm happy with that.
Great. So I'll put that into our kidney dish, and then we have our vial, or our ampule rather, that we put in our kidney dish also, that we can check later. And we have our alcohol swab for cleaning the skin. And now we can get rid of our rubbish. And we're going to grab our trolley, put on our sharps, our hand gel, and our medication. Okay, Lisa, can we do the final rites at the patient bedside now, please?
Let's go.
Thank you. Hi, Mr. Kickett. Just got that medication here prepared for you. Just need to check your name tag if that's okay. Okay, so we have Robert Kickett. Date of birth is the 18th of the 4th, 1960. His URN is 895231. And no allergies, is that right, Mr. Kickett? Okay, great.
Good. Right patient.
Right patient. And then we have the right medication. So we have metoclopramide, which is 10 milligrams and 2 mils.
Yep, so we got 10 milligrams.
And
Yep.
we have 2 mils
Yes.
there. We have the right time, so he hasn't had it before, and it's PRN.
Yep.
He's got it for nausea and vomiting, and he is nauseous at the moment, and we're giving it intramuscularly, and of course we have the right documentation.
Great. Okay, happy.
Thank you. So for Mr. Kickett, we're going to go into the vastus lateralis, which is the muscle in the thigh. This is the large muscle that can take up to 5 mils of medication. Okay, just pulling back these sheets for a bit, Mr. Kickett. So it's quite easy to find. Just find the greater trochanter and the knee, and the midway between that area. So it's the anterior lateral aspect of the thigh. You have a middle third of this thigh is the window for the injection. So our first step is to, of course, observe the site, make sure it's not dirty, look for bruising or cuts, and then to clean the site with an Alco swab. And we will be using that later. We need to wait for that to dry, and then we take our medication, uncap the needle, and Z-track. Z-track, pulling on the skin to the left and inserting the needle at 90 degrees all the way in. Now we hold the needle with our left hand and aspirate. So aspirate, making sure we get no blood coming back, and once there's no blood, we can inject, slowly plunging the syringe. Wait 10 seconds. Then we can remove the needle and remove the Z-track. Discard of the sharps. And just apply gentle pressure with the Alco swab on the site. All done, Mr. Kickett, well done. So that should take about 15 to 20 minutes to start working. But if you get any other signs or symptoms, please let us know, okay? If your nausea gets worse or anything else happens, let us know, press that call bell and we'll be here. But I'll be here in about 30 minutes anyway, okay, to check up on you. All right, shall we sign for that medication?
Yeah.
Also metoclopramide. Yep. And can you co-sign?
Yeah, sure.
Fantastic.
Okay.
Thank you.
Thank you.
So that is how to perform an intramuscular injection. If you want to know more, please access your local policies and procedures, your learner resource, or you can ask your lecturers. Thank you for watching.